So I know you guys sent some things that you want to talk about today, which I am all for. But I did have a comment from someone that I wanted to address because a couple people have asked about it, and I thought I would try to give a quick little reply to it for y'all. I don't know if this person is on the stream. They did send a reply saying that I was going to talk about this today. So the question that I wanted to answer was from Diana Mills 5243. She was responding to my video about, so Diana Mills asked if someone in the US can explain how the health system works there. And said, I'm really interested in this, but it's so hard to work out outside of the country. By the way, I'm an Australian, sort of know the British system. Yes, I will need to ask specific questions. For example, I have this condition, this is what happens, how does it happen, etc. So I just wanted to give a quick overview because a lot of people ask me this type of question. So in America, there's some public health, but you have to be in very specific circumstances to get it. It's very hard to get. And most people, everybody has to have insurance, but most people have it through their work. So it's tied to your employment, and the employer decides who they're going to go with, what insurance company they're going to go with, and works out the benefits that are provided through your insurance company. And they deduct whatever what is called a premium, which is what you pay into it ahead of time in order to be part of that insurance. It's private insurance, basically. And it's different for every company. It's different for every person because you have a couple different options that you can opt into as well. And then also, obviously if you leave work, then things change and it gets really, really crazy. If you have a pre-existing condition, things get very, very dicey. I don't know very many specifics about that because I never had that issue where I had to deal with that issue. But if you're going to the United States and you're going to work, you're going to have to figure out what kind of insurance policies that company offers you, and whoever negotiates your contract gives you the human resources information should have all the information and should go over it with you when you're hired. Most companies, you have to work at least 3 months before your medical benefits will even kick in, and you have to opt into a separate dental and eye care insurance as well. All of that comes out of your paycheck automatically. The amount is subjective based on which version they'll offer you a couple options and you have to pick which version works for you. Then once you go to the doctor, depending on what the nature of the appointment is, you may have to pay what's called a copay. So it's $20 or something like that. Or if it's a specialist, it might be a little bit more. And that's just to see the doctor. And then usually you'll get some kind of bill after the fact, depending on what tests were done. And like I said, depending on what the nature of the appointment is, and what kind of coverage you have. It's a difficult question to ask for specifics because it really depends on your specific situation, who you're working for, and what policy you're getting through them. And it's very proprietary information. So it's not something that is public that like anybody can access. So it's very complicated. So I understand how you're confused and you're trying to figure it out. It's very complicated. But my advice would be to talk to whomever you're going to work for, because most likely your benefits will be tied to that. And if you're not going to be working, if you're going to be on some kind of disability or something, you're going to have to talk to someone in the local disability department, and depending on what state, it might be different as well. So I know that probably didn't help you very much, Diana, but that's kind of a basic overview of how the healthcare system works in America. It is very complicated. It is very much dependent on you as an individual. And you have to pay for a lot of it out of pocket, so be prepared. I like this system much better, where I have to pay a little bit more in my taxes. Like when I had my stomach infection, I just went to the doctor. I had blood work done twice. I didn't have to do anything, just to show up for the appointment. It was amazing. And I still am a little bit baffled that I don't have a bill that I have to pay. But that's just me getting used to not having to do that and having a different perspective and having a different option, which is lovely. I agree that the US should have a public option at the very least. They're never going to get rid of private insurance completely because people make way too much money on it. But there should be a better expanded public option that more people can take advantage of, because a lot of people don't get the medicine they need, don't get the care they need, have chronic conditions because they don't go to the doctor because they're afraid of how much it's going to cost and all that kind of stuff. It's very rarely, it's not a good system. Not a good system at all. Women get a full year off of maternity leave in the UK after giving birth. I got 6 weeks. Copay, yeah. So a copay is kind of hard to explain. So you basically have to pay to walk in the door. It depends on your insurance, but most insurances offer like preventative care where you don't have to pay a copay. You can just make an appointment and go get a checkup and get done what you need to get done. Your kids get their shots, all that kind of stuff. But if I, like for my stomach infection that I had, if I had to go to the doctor, you always have to go to the doctor first, like your general practitioner first. You go to the doctor, and because it's not like a preventative healthcare, you have to pay $20 just to see the doctor. That's what a copay is. And then if they tell you have to go see a specialist, which I would have had to go see a specialist because it was gastro, then you have to wait for the appointment to go see the specialist. And then that, because it's a specialist, is an even a bigger copay. So you have to pay like $50 in order to get into the doctor's office to see the specialist before they even really do anything. That's what a copay is, though. It's basically you're paying to see the doctor. Yeah, it's definitely profit over health. It's not about like public health or anything like that. It's all about profit. That's what it boils down to. So anything that they can pull out or increase, premiums always go up every year. You always have to pay more for your insurance every year. And to be honest, I worked it out once. When you factor in insurance, plus the eye care and the dental is extra, plus what you pay to the federal tax system, plus what you pay to the state tax system, plus what you pay to local tax systems, plus what you pay into like Social Security and stuff, which is supposed to be your retirement. And then any deductions you do in a private retirement, which most people have a private retirement now because Social Security is not handled very well in America. When you add all of that up, we're basically paying just around the same amount that we, at least at our salary bracket when we were in America, what we would have paid equivalently here to not have to worry about any of that stuff after the fact. Plus, we still got bills and everything. After I had my daughter, we had bills showing up at our house almost daily for like 2 weeks, 3 weeks straight. And I wasn't working, obviously, because I was disabled still. And I only got a very small amount of money from the government for being disabled for that small amount of time. And I remember that my mother-in-law came to help us with the baby, and she was completely flabbergasted by the amount of bills that we were getting. And she was like, how are you going to pay for this? You're not even working. But I had to go back to work. I didn't have a choice because I had all these bills to pay.